Hello, welcome to my video presentation about Fluvoxamine Maleate, and my student number is U3256535. What is Fluvoxamine Maleate? It is an antidepressant medication. It belongs to the selective serotonin reuptake inhibitor SSRI drug class. It is commonly prescribed for the treatment of depression, obsessive compulsive disorder, OCD, and various panic disorders. Fluvoxamine works by increasing the levels of serotonin, a neurotransmitter in the brain, which can help improve mood and reduce anxiety. It influences mood, memory, sleep, sexual function, body temperature, and pain perceptions. The pharmacokinetics of fluvoxamine involves absorption, distribution, metabolism, and elimination. Firstly, the absorption. Fluvoxamine is well absorbed following oral administration, absorbed in gastrointestinal tract and then entering the bloodstream, leading to peak plasma concentration within 2 to 8 hours after dosing. Food does not significantly affect the absorption of fluvoxamine, and the bioavailability is 53%. Secondly, the distribution. The mean apparent volume of distribution for fluvoxamine is approximately 25 liters per kg, suggesting extensive tissue distribution, and approximately 80% of fluvoxamine is bound to plasma protein, mostly albumin. Thirdly, the metabolism. Fluvoxamine is extensively metabolized in the liver, primarily by the cytochrome P450 enzyme. The major metabolite is fluvoxamine acid, which is pharmacologically inactive. And lastly, the elimination. The elimination half-life of fluvoxamine is relatively short, approximately 15 hours. An average of 94% of fluvoxamine-related products were recovered in the urine, and only a small fraction excreted in feces. The mechanism of action of SSRIs. Fluvoxamine maleate, like other SSRIs, primarily acts in the central nervous system. SSRI binds to the serotonin transporter, also known as SERT. It inhibits the reuptake of serotonin, a neurotransmitter, at the synaptic cleft, leading to increased level of serotonin in the brain. This increased concentration of serotonin is thought to positively influence mood, emotion, and behavior, making fluvoxamine effective in treating conditions such as depression, anxiety disorder, and OCD. We are looking at physiological effect of fluvoxamine. It causes sexual dysfunction that are categorized as a syndrome known as post-SSRI sexual dysfunction. Its symptoms include failure to become aroused or orgasm, pleasureless or weak orgasm, and a premature ejaculation. It also stimulates suicidal thoughts and attempts, mostly in teenagers and young adults who are under 25 years old. The infrequent adverse effect of fluvoxamine is hypotension, tachycardia, whereas the common adverse effects are headache, dizziness, drowsiness, diarrhea, and nausea. Moreover, fluvoxamine and other medicine that falls under SSRIs are Schedule IV prescription-only medicine. Schedule IV medicine are only obtained on pharmacy from a pharmacist on prescription. Health professionals who can prescribe Schedule IV medicines are doctors, psychiatrists, and nurse practitioners. Here we have some counseling consideration of fluvoxamine. SSRIs are usually taken in the morning to minimize insomnia, but if it makes you sleepy, it can be taken in the evening. It can make an individual feel drowsy, so driving or using machinery is not recommended after the consumption of fluvoxamine. Consumption of fluvoxamine should not be stopped abruptly because it can cause withdrawal effects. Likewise, taking fluvoxamine with food minimizes stomach upset. And if you are taking this medication, you should tell your doctors, dentist, or pharmacist, as there may be significant interaction with other medication which can cause serotonin syndrome. You can take few seconds to test your knowledge about fluvoxamine. I hope you enjoyed this presentation.